Hi, I'm Emily Landon. I'm an adult infectious diseases doctor at the University of Chicago Medicine, and I'm the hospital epidemiologist. I'm leading our medical response to COVID-19. And today, I'm going to answer some of your questions and talk to you more about what this means for you. The coronavirus that we're facing in this global pandemic is not that bad for people who are otherwise healthy, and especially for young people. Almost all of young people and healthy people will be just fine even after they get sick. So it can be a little bit confusing as to why we're shutting everything down and sending everyone home for e-learning and why hospitals are taking such drastic measures. The important thing to know is that while it may be fine for most people, there are a small number of people, about 15% of individuals who get sick, who will need additional medical care. Of them, another small percentage of that number will need critical resources like a ventilator and other intensive care services in hospitals. And while it seems like a small number, when the entire population is susceptible to this disease and any number of us could get sick, it's important to remember that our hospitals aren't really set up to take care of 10 or 15% of the entire population at one time. That's why we need to slow the spread of this disease. And the important thing is for even the healthy young people who are going to be feeling relatively good, just maybe having a cough and a fever, who might stay home for a couple of days and then go out and hang out with their friends or go to work. They're going to be able to pass it on during that time. And they're even able to pass it on before they get all the way feeling sick. And that means we have to act proactively. You have to stay home now. And we have to avoid contact with lots of other people so that if you become sick later, then fewer people will have been exposed and fewer people will get sick. Those of you who study any math will know that if every one person who's sick infects 3 more people, and that continues on that way, it won't take very long for us to be able to max out our capacity in hospitals. You need to do your part to protect everyone else. It's important to keep that in perspective. This isn't the kind of pandemic that's going to kill us all, and we don't need to freak out about it. But we do need to take very serious measures to change the way we behave and the way we live. We don't have a vaccine and we don't have antivirals. And so we're not going to be able to just use those tools to help protect the most vulnerable among us. Instead, the only tool we have is you staying away from other people. I know it seems kind of remote to imagine that your behavior going out on campus or hanging out with your friends is going to affect a nursing home on the other side of the city, but we're all connected. And it's important, really important, that you take this idea and this advice to heart and do everything you can. Obviously, I'm not saying to socially isolate yourself so that you completely get depressed. In fact, you should still talk to your friends. Just do it electronically when you can. See some people once in a while in very small groups. Go out and take a walk. There's no better place for germs than the sunlight and the open air. Just don't hang out with a bunch of people in a closed space. Yeah, we all have to accept that we're going to have some contacts with other people in our lives, right? I have a son at home, and we have some close friends that live next door to us in our building, and we're kind of all a little team. If one of us gets sick, we've already accepted that most of us are going to get sick. But as long as we keep the infections inside that closed group, then we're going to be doing our part to help prevent the spread to other people. So if you get someone who's sick in your building or in your room, you're going to need to be careful. First off, somebody else sick in a building that you live in that isn't close to you and not living in your building isn't really that big of a risk for you, especially if you're following the instructions about washing your hands, wiping things down, cleaning things off, and using hand sanitizer. Don't touch those elevator buttons with your fingers, use your elbow. Don't be shaking hands with people. Those are the things that you can do to help reduce your risk from those sort of casual contacts in your general vicinity. Now, people who live close to you, if you all live in the same place, it's very possible that if one of you gets sick, the other ones will as well. If you're somehow vulnerable because of your health status, then you might want to rethink your living situation. Talk to the people that you can reach about this situation. Talk to your doctor, talk to your parents, talk to your counselors and your residence advisors. That's how you're going to get the situation sorted out. If somebody does get sick, the best thing to do is to follow the guidelines on the CDC's website about what to do if someone's sick in your house. Just because one person is sick doesn't mean for sure that everyone else has to get sick. And there are measures you can take to help protect yourself and to protect the other people living in that area. Go to cdc.gov and look for how to take care of someone who's sick in my house. Everybody's asking how long we're going to have to do this for, and I wish I had a good answer for you. Unfortunately, the answer is the longer it takes, the better. And the less dramatic everything is in the hospitals and on the news, the better it is for all of us. The best outcome here is that we all stay home for a long time, much longer than we thought we were going to have to, and nothing big and important happens. If you find that when this is all over that you feel like, why did I have to stay inside? Why did we have to do this thing where we did e-learning? We should have just stayed at school. Then everything worked. That's how you'll know that it was the right thing to do. If we wait until things are already out of control before we start taking measures like closing down bars, schools, going to e-learning, it's already too late. We've already overwhelmed our hospitals, and that's not going to help anyone. At this point, we still have the opportunity to slow the spread. We're not containing anything. A lot of people are still going to get sick, but if we spread it out over longer, and we take these social distancing measures, it'll be really disruptive, really difficult, and completely different than anything you've ever done in your life before, but it will really help. Fewer people will die, fewer people will have bad outcomes, and we'll all be better off because of it.